Good afternoon, everyone. Welcome to our weekly COVID press briefing, and I'll just continue how we start off every press conference. Practice good hygiene, wear your mask, and socially distance if possible. I know the manager's going to go over the list of numbers. They're trending in the right direction, but we still need to practice our 3 Ws as we go forward. So, and we don't know where Dr. Hirsch will probably talk about the variants, but we don't have a good idea how that's going to come about, if it's going to get worse come March or not, but we'll be prepared for it. So, nationwide, we have over 28 million cases of COVID-19. And unfortunately, we have 509, over 500,000 cases of deaths of COVID-19 in the United States. I remember sitting with Dr. Hirsch and the manager back last year when I said, wow, we have 2,000 deaths in the United States. I couldn't believe that number. So that's why you still have to practice all the 3 Ws going forward. The United States has administered 21 million doses of the vaccine, so they have been administered. So we're heading in the right direction. Statewide numbers, there's 573,000 cases, and there's over almost 16,000 deaths in the state of Massachusetts. Over 1.1 million doses have been administered in the state. Over 400,000 second doses have been administered. About 6% of the state's population now is fully vaccinated. Since February 8th, we've generally seen statewide new COVID cases below 2,000 per day. This is compared to a daily average of over 5,000 new cases per day in early January. So you can see the numbers trending in the right way. So this is a significant decline. We haven't seen numbers like this since before November and December increases. We are seeing a gradual decline in cases across the country and across the state. There were a number of hypotheses why this is happening. We cannot get comfortable even as the numbers are declining. Please continue to stand by the hygiene protocols, as I said earlier. Today, the Baker-Polito administration also announced Massachusetts will advance to step 2 of phase 3 of the state's reopening plan on Monday, March 1st, and also announced its plan to transition to step 1 of phase 4 on Monday, March 22nd. The city manager will be getting into the specifics shortly, but regardless of the reopening phase, again, please continue to wear your mask and be safe in all situations. Yesterday, the governor announced a number of new initiatives around the vaccine, including improvements to the online system and 50,000 new appointments going online today. We're already hearing about delays and issues with the new virtual waiting room. And this will be clear here, the vaccines are coming, and anyone who wants a shot, everybody should get a shot when you're eligible, you're going to get one. So it's not coming as fast as we like, but they are coming. The vaccines will be coming. And again, I know it's frustrating, but please be patient and persistent. We're going to get it right, and we're going to get vaccinated. The process, again, is improving slowly, and the more doses are made available to the state, you'll be seeing the process become more smoother. So, and I think Pfizer announced today they're going to do more in production along with the other drug companies. So hopefully the flow will be increasing dramatically in the near future. And we've only been giving out the vaccines about 2 months now on the national level, and we're continuing to learn more about the virus, the new variants, and also the effectiveness of the vaccine as studies are conducted. So again, just be patient and persistent. And as you know, the Johnson & Johnson vaccine moved towards emergency approval from the FDA earlier this week. This is a single-shot vaccine, does not require the same level of refrigeration and logistical planning as our current vaccines. It will also improve the speed of distribution as well as simplify the process. Again, we have no word on when these doses will be coming to the state, but there is expected to be an announcement later this week in Washington. Both Moderna and Pfizer have announced that they will be increasing vaccine production, and these will be working their way through the supply chain to the state and hopefully finally to the city of Worcester. Governor Baker also announced that hospitals will begin to administer vaccines again. This means that UMass Memorial Site Mercantile Center will begin administering vaccines again. I do not have any timeline for this work, nor do we know how many doses they will be received. So please keep an eye on reliable media sources, as well as social media and UMass website for upcoming announcements. Grant announcements. The state announced $4.7 million to the 20 highest impacted communities. That includes the city of Worcester. This is part of the administration's vaccine equity initiative that was announced last week. These funds will be focused on serving people in the communities of color, the homebound, and disabled residents. This work will be complement to the Commonwealth's $2.5 million public awareness campaign, Trust, Get the Facts, and Get the Vax. Adapting the campaign's messaging for specific communities, the initiative will focus on 20 municipalities with the greatest COVID-19 case burden, taking into account social determinants of health and disproportionate impact of COVID-19 in the communities of color. Starting today, registered veterans of any age can now get their vaccine at Bedford VA Hospital. This service is open to veterans from across the Commonwealth. The Bedford VA also announced that it will be conducting mobile clinics in the future. For more information on this, please go to www.bedford.va.gov. And there's also going to be a vaccine hesitancy survey. I encourage people to participate in the Academic Public Health Volunteer Corps COVID-19 vaccine hesitancy survey. The survey aims to assess attitudes towards vaccinations and the degree of hesitancy among Massachusetts residents to receive the vaccine. The survey is anonymous and will take 10 to 15 minutes to complete. Results will be used to understand communication needs and inform vaccine messaging going forward. You must be 18 years of age or older and residing in Massachusetts. To take the survey, visit recap.link/mass vaccine survey, and the deadline is by March 12th. We continue here in the city of Worcester to serve our seniors. We made over 1,000 calls to our seniors in this past week, and we delivered over 1,000 meals to our seniors. Again, just ask people, I know it's frustrating, the process of the vaccine. You will be vaccinated, and again, wear your mask, socially distance, and practice good hygiene. With that, I'd like to turn it over to the city manager. Mr. Manager.
Thank you, Mr. Mayor. As of today, the City of Worcester has 20,531 confirmed positive cases since the beginning of the pandemic. That's an increase of 304 cases over last week. So again, that's moving in the right direction. It's about 12 less cases this week than the previous week. So that's now 6 out of the last 7 weeks. We've seen a decrease in the number of new cases here in the city. So again, that gives us some sense of confidence that we're on a real trend here, moving in the right direction. And as long as we all stay kind of committed to the 3 W's, sticking with the mask wearing, the hand washing, the social distancing, and as we all work together to try to increase the vaccination rates, hopefully we can not only continue that trend but accelerate it in the weeks ahead. In the towns, Shrewsbury had 50 new cases in the last week, bringing their total to 2,517. Holden, 29 additional cases, bringing their total to 1,254. And then Grafton, 11 new cases, bringing their total to 970. The combined UMass Memorial and St. Vincent numbers, 68 COVID positive inpatients. That's down 11 from last week. 21 COVID positive ICU patients, that's down 9 from last week. COVID deaths to date, 679 in the 2 health systems. That's an increase of 13 from last week. And COVID positive health employees, 1,740, that's an increase of 12 from last week. Worcester specific deaths, an additional 8 over the last week, bringing our total of Worcester residents who have died due to the coronavirus to 407. The DCU this week had 12 patients at the field hospital. Let me give you a little update on our EDS, emergency dispensing site at the Worcester Senior Center, as well as our mobile vaccination efforts that we're doing, primarily being led by Dr. Castile, the Commissioner of Health and Human Services. To date, the Division of Public Health here in the city of Worcester have administered 8,469 doses. That's an increase of about 2,200 doses over last week. Again, I want to make sure folks are clear that does not count the number of doses that are given at the Worcester State University site. They're up to about 700 vaccinations per day that they're doing there. That is in addition to an increasing number of pharmacies and supermarkets that are also as available, as they have available vaccines, are doing clinics. So I would recommend to folks who are looking to get appointments to continue to go back and check, because we're finding that some pharmacies are coming online maybe the night before, and they get an allocation from their corporate headquarters of another 100 or 200 vaccines, and then put up those available appointments maybe the night before, and they go very quickly. So they're not necessarily there for the whole week, so you have to keep going back and checking to see if there's new opportunities at the pharmacies or at the grocery stores. So keep looking for those opportunities as well. In terms of the senior center location, we've done 4,841 first doses and 2,554 second doses to date. The mobile vaccination efforts, we've done 1,074 mobile vaccines, 638 first doses and 439 second doses. Just to give you a little sense, obviously phase one of the vaccination protocols had first responders amongst the first folks who were eligible. To date, we've had 340 Worcester police officers get the first dose, and 339 get the second dose. So that's almost exactly everyone has now gotten the second dose. Fire department, 311 have gotten the first dose, and 304 have now gotten the second dose. Our emergency communications, 38 first dose and 25 second dose. And the seniors that we've been serving as part of the 75 and above category, 1,373 have received their first dose, and we've now just begun the second dose for that category, and 71 seniors have gotten their second dose thus far. We know that there is continued frustration over the appointment system and the creation of, by the state, of the state's digital waiting room. It's kind of a waiting line, if you will. We think that's a good step for folks who can put their name in there on the waiting list and make sure they kind of preserve their place in the queue. And as we've talked about previously, sometimes there's appointments that somebody doesn't show up for, and there's a window of time that vaccine is, in its prime, if you will, and needs to be used within a short period of time. And so having that queue allows us to call people in a kind of a regimented order and say, hey, if you can get down here within a short period of time, we have some available vaccines. So take advantage of that. If you're in an eligible category and can't get the appointment you want, take that waiting list opportunity so that you might be able to be called on short notice if there's vaccines for an earlier clinic. Even with the addition of more appointments that the governor announced this week, there are new mass vaccination sites that have come online, including in Dartmouth and Natick this week. We know that there are additional ones that we're expecting are going to also come online here in Worcester County, which is going to take some of the regional pressure off. And so we look forward to those announcements in the near future. The mobile vaccines, I just want to kind of get into that a little bit. Obviously, our number one goal is getting shots in arms. That's, at the end of the day, what it's all about. How do we most quickly and efficiently and effectively get those shots in people's arms? And the mobile vaccinations are really a critical strategy in helping us do that. And I want to thank Dr. Castile and her team. She's supported by not only some of her staff, but some of the medical students at UMass Medical who've been kind of a roaming band of vaccinators who are going to these different locations. And I've mentioned before, so far they've gone to Abby's house, to the YWCA, Hotel Grace, Dismas House, Jana's Place, the Mustard Seed, among other locations. They also have begun the process of vaccinating at our Worcester Housing Authority locations throughout the city. So yesterday she was at the 1060 Main Street, Webster Square East Tower, where she was able to do 147 out of the 193 residents, or 76% of the residents in that building were able to get their first shot yesterday. Today she was at the companion location at 1050 Main Street, Webster Square East Tower, and delivered 143 doses there. So we've seen out of those locations a total of 196 out of the 296 residents, or 66% of those locations, get that vaccine. Over the next 2 weeks, the city will be administering first dose at the following locations. On Monday, March 1st, we'll be at the Elm Park Towers at 425 Pleasant Street. On March 3rd, Wednesday, Checkerberry Village in the Holden Housing Authority. We provide public health services to the town of Holden as well. On Monday, March 8th, we'll be at Belmont Tower, 40 Belmont Street. On March 10th, we'll be at Pleasant Tower, 275 Pleasant Street. In addition to our efforts as a city to work with the Housing Authority to go out and do these mobile clinics, Genoa Healthcare has been also administering vaccines to Worcester Housing residents. So they've been going to some of the smaller Worcester Housing sites throughout the city. So they've done 536 Worcester Housing Authority seniors and will continue with more clinics in the coming weeks. And it should be known, we're having a lot of conversations, appropriately so, about the equity of the distribution of vaccines and access of vaccines. 60% of our seniors in the Worcester Housing Authority are people of color. And so by us bringing these vaccines to those locations, we're really trying to make sure that not only are we efficient and effective in delivering it right where they are, so they don't have to find their way to the senior center or Worcester State, but we're also making sure that disproportionately impacted communities are getting the vaccine in as expeditious a way as possible. As the mayor alluded to, the governor today announced that on March 1st, cities and towns are allowed to reopen to phase 3, step 2 in the state's reopening plan. This will, among other things, lift the capacity restrictions on restaurants and still require, though, 6 feet of distance between tables and locations where people will be eating. The 90-minute limit for time in one of those restaurants is still in place. And with that, the city of Worcester continuing to trend in the right direction in terms of new cases. Effective Monday, I'm lifting the restriction on bar top dining in the city of Worcester. The governor's order also impacts indoor performance venues that have been closed for almost the entirety of the pandemic, allowing them to open at 50% capacity up to a maximum of 500 people. So that certainly is something that I know a lot of our cultural institutions and performance locations are certainly looking forward to. The governor also announced that as of March 22nd, the state will advance to phase 4, assuming that all of the current trends continue, hospital cases continue to come down, and vaccination rates continue to go up. So that means gathering limits at event venues and public settings will increase to 100 indoor and 150 outdoor. Limits remain the same for private settings, 10 indoors and 25 outdoors. In addition, large venues such as outdoor stadiums, arenas, and ballparks will reopen with a 12% capacity. For more information about the governor's announcement today, and the reopening plan can be found at the state's website, mass.gov. With summer around the corner in the city and so many people in Worcester excited about entertainment options, including just in about 6.5 weeks, the Worcester Red Sox, this is certainly welcome news that there is light at the end of the tunnel. And obviously, April 13th being opening day, we're excited for that important milestone. So I don't want to take Dr. Hirsch's role as Debbie Downer, but I do want to remind folks that we've seen previously that the gains that we make are not always absolute and permanent. They can be lost if we don't stick with the protocols, if we're not vigilant about our mask wearing, our hand washing, our social distancing, and as we have new freedoms and new kind of gathering limits and kind of steps toward normalcy, we need to do it consistent with the guidance. We can't get overly exuberant and get ahead of what the guidance is, because if we do, we risk falling back, especially given the new variants that continue to present themselves. So I think we're on the right direction. I think the numbers coming down, the hospitalizations coming down, and the vaccination rates going up are exactly the kind of data and numbers that we want to see. And together, we need to keep those all moving in the right direction. With that, I'll turn it over to Dr. Hirsch.
Thank you, Mr. Manager. So my Debbie Downer time is here at last. No, I think the trends so far have been very encouraging. Speaking to the two health centers and the two medical centers, all the numbers are going in the right direction, and it's very encouraging, again, that the number of hospital personnel numbers are going down. All those folks just about have been gotten their 2 vaccines. So it just kind of shows that in this tight-knit communities within the medical centers that you're not seeing people get sick, which is wonderful. The average number of new medical personnel getting COVID is down to like less than 1 a day, which, as you know from following these numbers, we were up to like 20 a day in the beginning of January. So I think definitely there's been a change in the atmosphere there. And I think we're all very cautiously optimistic that these are going to continue as the vaccinations keep going up. The great news about the Johnson & Johnson vaccine is that it's probably going to get its final approval. We're hoping even as early as tomorrow. We also heard, based on all of the projections of the increased production of Pfizer and Moderna, that we're going to go up as a state from having about 120 vaccines available each week to about 200,000 once this increased production is happening and Johnson & Johnson weighs in. So people have asked me a lot of questions about the Johnson & Johnson one, because we haven't really talked that much about it since it hasn't been approved. But I think that the news is pretty good, because initially it had come out that the efficacy rate of Johnson & Johnson was lower than Moderna and Pfizer. And so just to tease out those numbers a little bit to make you potentially feel a little more encouraged about it, yes, the Pfizer and Moderna both have a 95% effectiveness against you ever catching COVID. And if you did catch COVID, if you're in the 5% that do, you should have reduced symptoms. So Johnson & Johnson's testing range from 66 to 72% preventing you from ever getting the disease, which is lower. But if you tease that out a little bit, 86% effectiveness in preventing severe disease and 95% effectiveness in preventing hospitalizations. So I think that this Johnson & Johnson vaccine will have a very good effect if it's widely distributed, and the fact that it only involves that one shot will make the logistics of vaccination centers so much easier. So we're hoping that we will see at least some switch over to that modality when the general distribution phase happens, phase 3. And I think you'll see a lot of offerings of that. Johnson & Johnson production has not been cranked up to the max until they get the word from the FDA. So that may be a little bit of a lag time till it's widely distributed. But I think they're going to crank it up pretty quickly once they get the word, and hopefully that'll be in the next couple of days. The vaccination centers, as the city manager and the mayor referenced, they continue to do, I think, amazing work. We're humming at about 500 vaccinations a day at the senior center and close to 700 a day at the Worcester State University site. And it's really just a limitation of how much vaccine we get that continues to plague us a little bit in terms of being consistently able to say when our clinics are happening and how long they will run. But we, on the other side of the ledger, have not wasted a single dose. We haven't thrown a single dose away. And I think that continues to be an outstanding quality of the centers that we've stood up with the help of the emergency management group and my buddies at the WDPH. So we did a training up there this past Sunday of another 80 vaccinators for our vaccination army. Most of them were medical students, but we also did trainings for paramedics, dentists, and a few nurses who had come out of retirement that just wanted a refresher course. And I think that we're going to continue to probably have a need to train some more. We keep getting requests for more people that want to be trained. So I think this Army will continue to expand, and that will only help us, I think, prevent burnout from the vaccinators who have been very, very steady in being there, multiple times a week for long hours. So hopefully we'll be able to do more of a shorter shift for them so they get a little more of a break. So all of that is super encouraging, and here's the Debbie Downer thing, the strains, the variants. The UK variant, the British one, has been identified, as you know, here in Massachusetts, and it has a doubling time of about 8 days. That's the estimate right now. And the thought is that we just have not been able to do enough speciation of it to really know how much of it is in the community. But the suspicion is that a lot is in the community. Encouragingly, if a lot is in the community and we really start doing that testing and the numbers keep going down, maybe that's an indication that somehow it's acting differently than the way it acted in Britain. So we don't know that yet. We do know that Moderna and Pfizer have both reported good efficacy against the British variant, and maybe that's what's doing the tamping down of its expansion of the variant, of that variant. The South African variant and the Brazil variant have been not as easily crushed by the vaccine. The efficacy seems to go down into the 70% range instead of 95% range against those. And they haven't been widely seen here in Massachusetts, but there have been isolated couple of cases of the South African variant and one case of the Brazilian variant. So this may be the trend of this virus now, that we're going to start seeing the variants start to take prevalence. And the Debbie Downer part is if they outrace us as we're trying to get needles in arms, then we may end up in a losing battle, as these things are so much more transmissible and the vaccine is less effective against them. In addition, this week, New York City's Department of Public Health and LA's Department of Public Health both revealed that they have identified new strains that had not been seen before. One's being referred to as the California strain, one's being referred to as the New York City strain, and the properties of it have not been identified yet. This is, according to the virologists, the natural history of these viruses. They all are mutating kind of all the time. Their mission in doing this is to avoid getting stopped by vaccinations, but it's not to kill off the host. They want to spread to more hosts, but they don't want to kill off the host because then they have no place to go. So it's not clear whether these new strains are going to cause more death, but they may cause more cases. And that's the worry that the virologists seem to express, is that they're worried that sometime in April we might see an uptick again. We haven't, and that's all, conjecture right now. But that's why I think the 3 Ws are still going to be an important backbone of everything that we need to do. And I see too many times people posting on social media, I just got my second shot, we're going to have a get-together, we're going to take off our mask and all going to hug each other for the first time in a year. I get that that's what people want to do, and I want to do it too. But I think until we know whether you could be in that 5%, if Moderna and Pfizer is your vaccine, that could still get ill, or if you are a silent spreader that might affect the other loved ones that you've invited over, 3 Ws. Keep the 3 Ws going. And I know that we're going to be, really challenging the system, opening up, as the governors described, into, part 3 of phase 3, or part 1 of phase 3. But I think that if we do that with all the mitigations that the city manager and the mayor referenced, we can undo the potential worsening of the spread by just being cautious and safe. I'm really excited about the Woosocks opening up on April 13th. I think it's fantastic news, and I'm certainly going to maybe be second in line to try to get in there. But I think I've looked at the mitigation plans that Dr. Steinberg has put into place, and his team at the Polar Park have done a great job planning things out. And I think it's going to be a very encouraging environment and be a really new day for Worcester, which is going to be awesome. So I'm going to quit there only by saying today would have been the 78th birthday of the quiet Beatle, George Harrison. And of course, he referenced in one of his great Beatles songs, "Here Comes the Sun." It's been a long, cold, lonely winter, and now things are getting clear. I think that's where we're going. He also had in his first solo album in 1971, "All Things Must Pass," and I think that's what's going to happen to this virus too. So thanks.
Steve, any questions?
Tiffany Williams, Worcester Daily News. To either the manager or the mayor. As you say, some days may pass or some days have to pass. So there's a group in Worcester that has been organizing to get the hoops in the city reopened at city parks and playgrounds, and also in locations like high schools and stuff like that. Now that we're going into a new phase where arenas and stuff like that can up their capacities, when can the city, or when will the city open up hoops in the city of Worcester? And then I have a follow-up question.
In the phasing that was just opened up, It doesn't specify yet about these kind of athletic activities, although we have allowed high school athletics to continue in most of the communities that we serve in our health district. I think that Superintendent Benenda is going to be opening those up as well. So I'll leave it to the mayor and the city manager to say what they want to do with that. But I think that, you know, once the courts are clear of snow and ice, I think it'll be the right time to open.
Yeah, I think it's something we're, like the bar seating, something we're always looking at, given the fact the governor just announced today some of these new changes. You know, we'll go back and talk about what other changes might make sense now or at least in the weeks to come, so we'll see.
Just one question. Second question.
In regards to the schools, and as you probably know, we're going to open outside sports, be football, soccer, field hockey, and outside track. We're not doing any inside sports, and because of the COVID-19. But as the manager said and Dr. Hurst said, more to come after. We keep on going in this trending. The numbers are trending good in March, and we'll see what we can do on the school side of things too. Thanks.
Before you leave, Mr. Mayor, there's pressure across the country and in Washington to reopen schools safely. Being the chair of the school committee, when do you see safely the schools reopen in Worcester instead of just remote?
We'll be talking at the school committee meeting tonight. We are scheduled to go mid-March with special education students, and at the end of March, every other student will be coming in a hybrid, and we'll discuss how we want to proceed in April. I think depending on the vaccines, where the numbers are trending, we'll evaluate probably sometime in March what we do in April.
This may be for the city manager or Dr. Hirsch. It seems like each week now we keep talking about the variants, and that's come up a lot as some things just sort of in the back of our heads. I remember in the spring, and I think even going into the fall, it seemed like at a certain point, maybe through the health centers or the medical centers, there seemed to be a model that sort of got activated as far as like, oh, we expect the surge to be this day or that day. Is there a similar framework for these variants, or we just don't know enough about them yet, or you know, is it still just sort of anecdotal?
Yes, Steve, unfortunately, I think it is not clear which way those variants are going to go. They haven't spread like wildfire like they did in the UK thus far, but we haven't been as aggressively testing the speciation of the positive tests that we get as the UK was. So is it not as prevalent because we're not testing enough to know that, or is it all over the place already and it just hasn't had the oomph that it had in Europe? We don't know that. So that's why I think that there are several models that are out there, and there was certainly one that I saw today that suggested a third surge would come in April. But I don't think we're widely adopting that model yet until we see a little more information, and it really is a week-to-week proposition.
It just seems like you know, the virus doesn't have a sense of timing, but we had the announcement this week from the state, as Joe had hinted at, that the school committee would be discussing tonight, that they're really starting to put the pressure on local districts to get kids fully back to school by, lo and behold, April, when we're sort of keeping an eye on these variants, and it seems like that might end up being a clash.
I think that's why it's so important, and the city manager referenced this, that if we continue to get the needles in arms, I hope that would include a big cohort of the adults that take care of our children in the school system, and I think that would really mitigate against a lot of super spreader event that you could get in the schools. We are not seeing, again, a lot of disease in the kids from a minor standpoint, but there has been a slow upward trend in this inflammatory response thing that is being seen across the country. And this may be a lingering effect of having had COVID during the real big surge in November and December. It may be lagging behind that surge. So we just have to sort that out too. We just don't know yet if that's a new trend and whether the new variants are pushing the age of the victims lower.
And I just had one final question for the city manager, perhaps. With the ballpark, and the outdoor venue relaxations that the governor announced, I haven't fully gone through that all yet. But as far as the capacity with the new stadium, I know that going into this, you guys probably had an idea that it was going to be at least somewhat restricted, if not fully restricted, at the start of the season. Does the capacity number that the governor threw out today, is that sort of work with your numbers and the team's numbers as far as getting things off the ground?
Well, we're excited about having any fans to be able to be in the stands, even if it's 12%. And I think, like all of us, we're trying to balance public health with normalcy and activity and all of that. So we're appreciative that we're going to be able to play our first game on April 13th. And again, it's 6.5 weeks from now, believe it or not. It seems like it's been a long time coming, but it's getting real close. And the idea that 12% of the capacity can watch the game. And my expectation is if we do continue to move aggressively with more vaccines every week and keep, strong compliance with the protocols, we'll, over the course of the season, see those numbers increase. And, I think that will be just a welcome kind of reward for all of the sacrifice and all of the efforts that everybody's been putting into this. So I'm very pleased that some people are going to be able to get in and enjoy that park. And I will tell you this, people are going to be blown away when they get into that ballpark and see all of the amenities in that ballpark, see the kind of way that ballpark just is knit into that neighborhood and connected with the city, and Union Station off in a distance. I think people are going to be really, really proud and excited. And each game is going to see more and more people talking about it and kind of singing the praises. And I was excited to see that Nesson is going to be doing about 50 games. So that's another big deal because that's Worcester's brand and Polar brand and Table Talks brand and all of the other iconic Worcester businesses that are going to be in the backdrop and are featured in that ballpark are now going to get that national exposure in the 50 nationally televised games. So I think that's a big deal and one of the other kind of benefits of Polar Park.
Thanks.
So this is for the manager, or I guess the mayor can take this as well. I hate to harp on this because I understand it's not your decision, but have you gotten any indication from the state as to the status of the Worcester State site as a large vac site, changing it to a mass vac site? I understand that it's a little bit of a technicality, but obviously there are perks that come with the mass vac site, such as priority on vaccine and that type of thing. I know it's a state site, but have you had conversations? Has the governor made any indication that they're going to change it, and if not, why not?
My understanding is it's not a big. There were some initial differences in terms of the ability of a caregiver to somebody 75 and above to be able to get the vaccine. Those have been taken care of in those. So there really isn't a lot of distinction. Right now, the primary distinction is, does the state contract with the entity and the providers to do it, which they do at the mass vac sites. In this case, the state isn't contracting to do that, but the three parties have come together to stand that up. It is getting a priority in terms of minimum of 500. We thought that was going to be for 2 weeks. We've actually been able to get up to 700 the second week. And the goal would be to continue to grow that to ultimately hit the 2,000 capacity that we have per day. So really at this stage is a distinction without a difference, mass vac site versus large vac site. It's on the prep mod system. It's available to anybody, anywhere, as long as you're in an eligible category. So I don't think it's kind of an important difference at this stage.
Okay, thank you. And my other last question is, Dr. Hirsch, so we see the case numbers going down, and I was wondering if you could shed any light on whether this is folks doing kind of more of the 3 Ws, or is it more that the folks are starting to get vaccinated, plus the folks who have had it are starting to create not full herd immunity, but are starting to create less hosts for the virus to pass into? Is that happening? And will that continue the good trend with more people being vaccinated even before full herd immunity?
Well, you can see as an example, it's a great question, Ben. We've had essentially 1 out of 9 citizens of Worcester roughly have had the virus. And if we throw in again that we're, vaccinating now and in the state about 10% of our people, I think additively we're getting up probably, into the 20% range of people that probably have some immunity. And I do think that probably affects the way the virus can spread. But it's not nearly enough to get us to where we want to be. But there's other theories. There's theories that somehow this is related to, the absence of all those congregant activities that happened around Christmas time. This has been more the dog days of winter where people are kind of hunkered down in the bunker with all the snow and everything, and they're just not as with each other as they were over the holidays. So that may be as much a reason of the decrease as anything else we can explain.
All right, thank you.
Mr. Manager, you talked about the Red Sox and the capacity limits with the Red Sox. What about the DCU Center and live events over there? And arena football is also supposed to come back in April. So what does that mean for the Massachusetts Pirates?
For the time being, we're using the DCU as the field hospital, and until we and the Commonwealth decide to take that offline and decommission it, that's where the primary use is going to be. So we're not going to be in a position to book events. Now, on the arena side, they may be able to do some games, whether it be limited folks who come in to watch the games. So that's certainly a possibility, but on the convention center side, the priority is still the field hospital until we announce that it's coming down.
For the city manager, or maybe this is for Dr. Hirsch, but what are the conversations or the plus and minuses, Wade, where listening to the press conference, it seems like if we were to stay with the current standards we are now, you may, knock the virus out, so to speak, or even have a leg up. What are the benefits of opening up more risk, where if we're closed for another month or so, it might be over, but you open yourself up to another surge, which may obviously extend more closures down the road?
I've talked about this, I think, for the whole past year plus, that everything's a balancing act. You're trying to strike the right balance between, obviously protecting the public health, but also trying to keep businesses open and keep jobs in existence and all the benefits that come with that, and people being able to pay their mortgage and pay their bills. So trying to strike that balance. We do have something at our disposal now that we didn't have during the first kind of wave or even the beginning of the second wave, which is the vaccine. And so that is a tool in our toolbox that wasn't available to us at the start of the second wave. And, as Dr. Hirsch said, every week we're announcing thousands more, literally thousands more first doses getting into people's arms. And I expect that to continue to ramp up as vaccines become more plentiful. We've got kind of the infrastructure in place now. We just need more vaccines to really get those numbers up significantly. But I do think that's maybe a differentiator now than previous stages.
And just on the schools, I just mentioned too, and this goes to Mike's question a little bit, but it's a balancing, as the city manager just said. And you remember, hopefully, if I had my way, I'd have all the kids back into school, right? But there's a huge safety issue here too, a health concern. You look at, if we can get the teachers vaccinated, hopefully we can by April with the second shot, there's a possibility because they're in the next phase, the next step in this phase, that'd be great news for the schools. You remember too is when kids Dr. Hirsch had mentioned, I think it was the last meeting, that 19 and younger are the biggest, catching the virus at a larger rate than any other group. So I think that's still true, Doc. I think that's still true. So you got to remember, these kids, we're not even in school. And now you bring all these kids in school in the hybrid coming at the end of March. And they all go home to dense neighborhoods, three-decade neighborhoods, generations of people living there. So we balance all that. We balance it all together. Whether or not we're going to bring back our students full-time back in April. And it's probably doable if the trend keeps it going the way it is. We get vaccinated here in the city of Worcester, more vaccines come available. And I think the school committee will make that decision, evaluate that as we go through the month of March. Thank you. Everybody else set then? Good, thanks. Yep.
Thank you.